A member of Ozark Mountain Herbalist recently requested that I do a video on appendicitis. And I know what you're thinking. That's going to be a really quick video, maybe 1 minute, because you get appendicitis, you go to the hospital, you have it removed. End of story. However, what if you cannot get to the hospital? You cannot get to the doctor. Are there any herbal options to help you out? So that's what we're going to dig into today, especially focused on Ayurveda and the Chinese medicine approach. So here we are in the herbal database. I'm going to show you how to find appendicitis. You could use the search box, but today we're going to use the menus. We're going to go to diseases and disorders. We know this is a problem in the digestive system, so let's go there. And gastrointestinal disorders. And let's scroll down to gastrointestinal infections, and we find appendicitis. So appendicitis is basically an inflamed appendix. And we're going to get into the pathology and the symptoms. It is considered a medical emergency that requires immediate surgery. But like I said, what if that is not an option for you? What else can you do? Now, more recently, the appendix is being saved by the medical doctors by using antibiotic therapy. Now, this occurs when the appendix becomes inflamed and swollen. It's going to be most common between the ages of 10 and 20, and less common after the age of 50. So what is the appendix? It's a small finger-shaped pouch that sticks out from the colon on the lower right side of the belly. What causes it? Well, infections in the digestive tract, like viruses, bacteria, or parasites. Could also be stool blocking the tube that joins the large intestine and appendix, and it could also be due to tumors. Now, it typically starts with pain in the middle of the abdomen that may come and go. Within hours, the pain travels to the lower right-hand side and becomes constant and severe. Pressing on this area, coughing, or walking can make the pain worse. There's a single opening to the appendix that connects it to the bowel, and this leads to a dead end. In the appendix, pathogens can get trapped due to obstruction at the point where the appendix meets the bowel. Trapping of pathogens leads to infection and inflammation. And inflammation may proceed to gangrene and rupture of the appendix. When the appendix ruptures, fecal contents and infective material are released into the peritoneal cavity, and this leads to peritonitis, an inflammation of the peritoneal lining. You see a diagram here that shows the appendix when it's obstructed and infected. So what are the signs and symptoms of appendicitis? First of all, the location of the pain. It's going to start near the navel and then shift to the lower right abdomen. Within the first 24 hours, it eventually becomes localized. Now, there is a test called McBurney's point. On palpitation of the abdomen, there's a tenderness at McBurney's point. And here you can see where McBurney's point is located. And then we've got another sign called Rothschild's sign. And this is where the pain increases when you suddenly release the pressure of a deep palpitation, and the pain of releasing the pressure is worse than the pain of the actual pressure itself. Then we can also use percussion tenderness. This is pain and tenderness when percussing the abdomen. rebound tenderness and percussion tenderness suggest that peritonitis has occurred, which is inflammation of the peritoneal lining, potentially indicating a ruptured appendix. Now, as far as the characteristics of the pain go, it's steady and worsening over time. It's often sharp and localized. It worsens with movement, coughing, or pressure. And there are other symptoms like a low-grade fever and chills, loss of appetite, nausea and vomiting, constipation or diarrhea, and abdominal swelling. Diagnosis of appendicitis is based on the clinical presentation that we just went over and raised inflammatory markers. Now, a CT scan could be useful to confirm the diagnosis, especially where another diagnosis is more likely. An ultrasound scan is often used in female patients to exclude ovarian and gynecological pathology. Ultrasound can also be useful in children where a CT scan is less appropriate due to the high dose of radiation. So appendicitis is mostly a clinical diagnosis based on the signs and symptoms rather than any diagnostic test. Where the diagnosis is unclear, a period of observation can be used with repeated examinations over time to see whether the symptoms resolve or get worse. When a patient has clinical presentation suggestive of appendicitis, but investigations are negative, the next step is to perform a diagnostic laparoscopy to visualize the appendix directly. So what's the differential diagnosis of appendicitis? What else could it be? In a female of childbearing age, you might want to look for the possibility of ectopic pregnancy, another medical emergency, and it has a relatively high mortality if mismanaged. You could also look for ovarian cysts, and these are dangerous and very painful, especially when they rupture or there's torsion. Now, ultrasound can be used for that. There's something else that's called Meckel's diverticulum. It's a malformation of the distal ileum that occurs in approximately 2% of the population. It's usually asymptomatic and doesn't require treatment, but it can bleed, become inflamed, rupture, or cause different problems. And the other possibility would be mesenteric adenitis. Mesenteric describes inflamed abdominal lymph nodes, and it presents with abdominal pain. It's usually occurring in younger children and most often associated with tonsillitis or any upper respiratory tract infection. No specific treatment is required. And then, of course, the question might come up, well, could this be gallstones? So here we have a comparison between gallstones and appendicitis. For cholelithiasis or gallstones, the pain is going to be in the upper right abdomen. The pain trigger is going to be, it occurs often after a fatty meal. Pain can radiate to the back or right shoulder. Fever is possible if infected. Jaundice is possible. Appetite could be normal. But when it comes to appendicitis, the pain is going to be in the lower right abdomen. And as far as the pain trigger, there's gradual onset worsening over time. It rarely radiates pain. Fever here is common. Jaundice is unlikely, and often there's a decrease in appetite. There's some videos here you could go through, but let's move on to treatment. Why try to save the appendix? For many years, it was considered a vestigial organ, meaning it was thought to have lost its original function through evolution. However, recent studies suggest the appendix can play a role in our immune system. It acts as a reservoir for beneficial gut bacteria that can help repopulate the intestines after a gastrointestinal infection or antibiotic use. Additionally, the appendix contains lymphoid tissue involved in the production of antibodies and the regulation of immune responses. The standard of care focuses on either surgery or antibiotics. Keep this in mind. This is considered a medical emergency if it ruptures. Obviously, the key to this is to catch it early, before it ruptures, before it gets severe enough to absolutely require surgery. Now, you've already seen some of the signs and symptoms that will help you determine that you might have a case of appendicitis flaring up, and then you could go to your Ayurveda remedies. Now, Ayurveda is especially good with chronic appendicitis. We're not going to get into that, but if you click on this link, chronic appendicitis, you can learn what that is. It's relatively rare. Now, there is something called Vidradhi that you can click on here that explains a condition in Ayurveda that deals with inflammatory swellings, abscesses, and pus-forming conditions. And they're collectively described under this term. This ancient concept closely aligns with our modern medical understanding of abscesses, including conditions like appendicitis. And in Chinese medicine, they also treat it as fire toxin, which can include abscesses. So apart from herbal treatments and diet, certain therapies can help manage appendicitis symptoms effectively. I'm going to invite you to subscribe to the database to get all of this information. For example, you can use Panchakarma therapy. That's a detoxification therapy that helps eliminate toxins from the body. And here are some types of Panchakarma therapy. You can pause this and read it. And we've got a video here on a remedy that's used for appendicitis. But here are some of the Ayurvedic herbs. Again, these are all hyperlinked. You can click on them and learn all about them, including how to use them, dosages, cautions, etc. So I'm just going to scroll through this, and you pause it and you can look at it. Some of the other plants that you may be familiar with include fenugreek. Here's a recipe. Boil 2 teaspoons of fenugreek seeds in a cup of water. Strain and drink once daily. It helps with early appendicitis. Yogurt can help. Just 2 tablespoons of yogurt in a cup of water. Drink once a day. You could add roasted cumin and thyme seeds for better results. Raw mung beans or sprouted beans can be consumed in the morning. Of course, our good old ginger, that's going to help here as well. And then use an Ayurvedic diet. Consume easily digestible foods like soups, boiled or steamed vegetables, steamed rice. Increase fiber intake. Stay hydrated. Avoid spicy and fried foods. Include probiotics. And there are lifestyle changes to prevent appendicitis. Remember, in some cases, appendicitis can become chronic. These include yoga, pranayama, which is breathing, excessive physical strain that can worsen symptoms, maintain a regular eating schedule, get adequate sleep, because that's when we heal. And next, we've got a section on combined Chinese and Western herbalism approaches. Now here is a type of therapeutics related to Chinese medicine. Clear toxemia, reduce inflammation, clear fire toxin. So for appendicitis, in traditional Chinese medicine, the condition is often interpreted as a manifestation of fire toxin with blood stasis and damp heat, especially when there's localized pain, swelling, fever, and signs of internal abscess. And the most widely used Chinese formula for this presentation is Dawang Mudong Teng, rhubarb and mouton decoction. You can click on that to be taken there. This formula is especially tailored for intestinal abscesses, including appendicitis, in its early to moderate stages before rupture or surgical emergency. And here are the core ingredients and their functions. Again, you can pause the video to read that. And as far as its clinical use for appendicitis, it's used when appendicitis presents with lower right abdominal pain that worsens with pressure, fever possibly alternating with chills, guarding of abdominal muscles, constipation or dry stools, yellow tongue coating, slippery or rapid pulse. And it is particularly effective when the abscess is forming but hasn't ruptured. It works by clearing heat and toxin from the intestines, breaking up blood stasis to reduce swelling, draining pus, and promoting resolution of the abscess, softening the stool to relieve pressure. Now you can modify it based on presentation. If the patient has more dampness, you add quasseed to drain damp and support pus resolution. If there are more severe toxin signs, add honeysuckle or dandelion. If there's cheese stagnation and bloating, you use unripe bitter orange or magnolia bark. And here's some important notes, of course. It's not a substitute for emergency care. Again, this is something that you can use if you must. If you cannot get to emergency care, use these early. And this particular formula can be used alongside antibiotics or post-surgery. Now, even when there's surgery, there can still be a problem with appendicitis in something called stump appendicitis. That's where not all of it was removed, and the little tiny part that remains can get infected and you have appendicitis again. We've got some articles and studies here, some interesting ones about the causes. So a colonoscopy could put you at risk, and it may be a hidden danger of GLP-1 receptor agonists. So a lot of people are taking those for weight reduction. I'm not going to pull up that study, but if you click on any of these studies, you can pull them up and read about them. Blunt abdominal trauma could cause appendicitis, and there's some studies here on the types of bacteria that tend to cause it. Here's some information on chronic appendicitis. And then we have more on diagnoses. There are certain markers that are looked for by your doctor, like hyponatremia. And then as far as treatment goes, here are some studies. Here's one that shows that antibiotics may be a viable treatment option for appendicitis. This is an interesting one here, a case study where a medically supervised water-only fast followed by a plant-based, low-fat, low-sodium diet achieved remission of suspected uncomplicated subacute appendicitis. This is interesting too. An appendix removal is linked to lower risk of Parkinson's. And to finish up, you might want to just look over on the left-hand side of the screen at some topics that are related to appendicitis. Here is the one on clearing toxemia, I would invite everybody to check that out. And then, of course, we've got peritonitis, if you don't know what that is. Sepsis is another complication that can arise. We have a lot in the database on how to deal with sepsis. Here's another Chinese formula that's useful, and Japanese St. John's wort. So with that, I'm going to finish up, and I hope this has been helpful to you. Let me know if there's another topic you'd like me to cover, and I'll see you next time.